Recently in the literature there was published an article talking about the Multifidus lift test, and this was checking for timing of the multifidus. And this test was validated, it was compared to using an ultrasound to see if the multifidus were kicking in, and it has to kick in prior to the motion being performed. And you can do it by palpation. Now if you were going to palpate the multifidus, you have to go right off the spinous process. This particular test was assessed at the L4, L5, L5S1 level. And it had pretty decent results. So you would get on the spinous process, and then you would come just lateral to it, or just medial to it, and palpate, and then you would have the patient lift their leg. And what you should feel is the multifidus on the opposite side kicking in first before the lift, and then come on back down. And then you can check it on the other side as well. And come back down. So this study was done on about 32 patients, and it showed good reliability of the therapist being able to palpate the multifidus. Now, this test is good, but you can get a lot of unnatural motions because this is a heavy stability demand on the lumbar spine, load transfer demand. So I like to do it in standing. So I'll have the patient stand, and I'll palpate the multifidus, and we can actually have them raise their arm up, and when they raise their arm up, you can feel, while they're raising the right arm up, the left multifidus kick in a little bit before, if it's functioning well. If not, you're not going to feel the multifidus kick in first. It'll come in late. There'll be a lag. And the same on this side, where there was a little lag in this one, so that's the one that we might need to uptrain on this side. And it has them in a functional position when you're checking it, and less of a demand of load transfer through the system. So instead of going leg multifidus, you can go arm multifidus, and it'll kick in, and it'll be a little more subtle of a contraction, but you should still be able to palpate it. So give it a shot.